Hey, guys. Good evening. It's another episode of Therapy Thursday. I'm your host, Dr. Delvina, board certified psychiatrist in South Florida. Are you ready to take the couch? So, you guys know on some Thursday nights, I do a topic. I bring on a guest most of the time so that they can school me. We can have an expert to discuss the topic. And tonight we're discussing weight management, weight loss, and weight loss surgeries. And I love when I can bring someone up who looks like I do, who looks like most of us, who's melanated and is brown or black or the African diaspora. And so tonight I do have someone who shares those qualities. So tonight we're talking about weight management. We know that eating crappy food is not a reward, man. It may feel good to you, but according to Drew Carey, eating crappy food isn't a reward, it's a punishment. We know that weight loss drugs first entered, or if you didn't know, you know now, weight loss drugs first entered mainstream markets during the 1920s, the early 20th century. Physicians would prescribe thyroid medication to healthy people to help them lose weight. In the 1970s and the 1980s, they started trying some different interventions such as jaw wiring. They would wire your jaw shut so that way you wouldn't eat yourself to obesity. You wouldn't eat yourself and become overweight. You wouldn't eat yourself to death. Yo-yo dieting has been linked to heart disease, insulin resistance, higher blood pressure, inflammation, and long-term weight gain. What do I mean by yo-yo dieting? That's someone who goes on a different diet or maybe the same diet, but they're not effective in adhering to that diet, but they go on a diet and the diet fails. And so, or the diet succeeds, but they don't maintain, right? They don't maintain those rules and live by those rules and those limitations that they set. So they lose weight, gain weight, lose weight, gain weight. That's yo-yo dieting. One of the early treatments for obesity is something called stereotactic surgery. It's also known as cycle surgery. It involves burning lesions into the hypothalamuses of people with gross, quote, gross, close quote, obesity. Approximately 97% of dieters regain everything they lost and then some within 3 years. And I've seen that happen with people who have undergone surgery, who have had the gastric bypass and some of these other procedures. Some of them regain a lot of their weight. So studies show 97% of dieters regain everything they lost and much more. In 2000, about 37,000 bariatric surgeries were performed in the United States. In 2013, the numbers had risen to 220,000. And maybe my expert can tell us tonight, it's 8 years later, how many surgeries have we had, these bariatric surgeries? Bring that slide back for me, producer. The word obese is from the Latin obesus, or having eaten until fat. I know people don't like the word fat, but I'm just reading to you what I saw. This is what I saw in some of my research. And so I told you I have an expert on tonight. I told you this is a melanated individual. This is a man. The last expert on Therapy Thursday was a woman, a lady. We have a gentleman tonight. He's going to share with us some information regarding weight loss surgeries. I can't wait to get into this discussion because, listen, to undergo these surgeries, you have to undergo a mental health assessment. I'm sorry, I see messages that are coming up on my screen. You have to undergo a mental health assessment. You have to have clearance to undergo these surgeries. So I just want you all to be aware of certain things. As a psychiatrist, we help people a lot too with weight loss goals and weight loss management. And we have to ensure this is a big step when you decide that you want to lose weight by a surgical procedure. This is a big step. So you want someone you can trust. You want someone who's going to talk to you. You want someone who's going to help you through things and answer your questions and explain everything. You want to be an informed consumer. You want to be an informed consumer. So guys, introducing my expert tonight. Tonight's expert is Dr. Romain Joseph. He is a board certified surgeon, practicing in South Florida. He obtained his undergraduate degree from the University of Miami, Florida. He received his medical degree from the UMDNJ Robert Wood Johnson Medical School in New Jersey. That's my old stomping grounds there in the Northeast. He completed his residency in general surgery at the Brookdale University and Medical Center in New York. Dr. Joseph also completed a research fellowship in colorectal cancer at Sloan Kettering Cancer Center in New York, and multiple specializations, including hernia repair, minimally invasive robotic surgery, breast surgery, colorectal, thyroid, parathyroid, and gallbladder biliary surgeries. Don't come on here, though, asking him questions about breast. We're not talking about breast augmentation or breast reduction. We are talking about the midsection, the stomach, and that area. Dr. Joseph is the Associate Chief of Surgery at Jackson North Medical Center, and he is an active member of the Department of Surgery at North Shore Hospital in Miami and Florida Medical Center in Broward. He is a member of numerous medical and surgical societies, which I know him from the Dade County Medical Association. Dr. Romaine Joseph has devoted many years at the service of the less fortunate through the Joseph Surgery Scholarship and Mentorship Program, in addition to multiple medical and surgical missions in impoverished countries. Welcome to Therapy Thursday.
Thank you. Thank you so very much.
Absolutely.
Thank you for this wonderful introduction.
Of course. We need your expertise, Dr. Joseph. We need you tonight.
Well, I'm all yours.
Okay.
So, everybody following us, the pleasure is mine. It's an honor to be here tonight.
Awesome. And guys, please pull up the Instagram. Dr. Joseph is on Instagram. He's Joseph Surgery on Instagram. He's going to, he's a surgeon. So surgeons, like, they work weird hours. They get called to do stuff in the hospital. They're on call 24 hours at times or whatever. I don't know. I haven't been in residence for so long. But he works a lot of hours. He works more hours than I do, I'm pretty sure. So he may not have time to post every day or every other day, but he posts some cool stuff up there and videos and pictures of surgeries. And speaking of a video, I want to start first, Dr. Joseph, by showing you this video, if that's okay.
Sure.
All right, let's.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. The upper portion of the small intestine is reconnected to the lower part of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. By altering the anatomy of the gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
All right. So, Dr. Joseph, what do you think about that video?
I unfortunately did not see it.
You couldn't see the video?
No, I'm sorry. I couldn't see anything.
Oh my goodness. I wonder if the folks watching could see the video. Huh. Audience, could you tell me, could you see the video that we just pulled up for you? Okay, yeah, someone just said she had no idea that's how the procedure was performed. So it was basically a video about the gastric bypass procedure.
Okay.
You're showing what takes place, how you create the pouch,
Okay.
and how you you
Did the whole bypassing the intestine and so forth.
well, break down, what do we mean by bypass? What does that mean exactly? So break that down.
Well, so the stomach, whenever you eat something, it goes in your throat, that part that we call esophagus, into the stomach. And from there, it goes into the small intestine. So if you think of it, let's say it goes into part 1, part 2, and part 3 of your small intestine. Let's say 4, 1, 2, 3, 4 of your small intestine. And in part 1 and 2, this is where you absorb most of your fat. Most of the fat, the protein, or everything that you absorb in part 1 and 2.
So I'm going to pull up a depiction and
Exactly. That's perfect.
okay.
So the first picture shows the normal anatomy. So everything goes into the stomach, and from there it goes into the part that says the duodenum, and then the jejunum. So that's part 1 and part 2. That's where you pretty much absorb everything,
Okay.
including the fat, the part that's not good for you. So by bypass, we means that when we cut that segment and then we reconnect it to a lower segment. So we cut the stomach, and instead of going through 1 and 2, we send it directly. Whatever you eat goes directly to 3 and 4.
Okay.
So we bypass 1 and 2.
Gotcha. So you make a connection directly from that stomach, that pouch that you
That little pouch. Mm-hmm.
by resecting it from the stomach. So guys, see on the right side of the screen, it has here stomach pouch. It becomes a pouch because it's surgically cut or severed or
exactly.
yes.
So we make it very small, so you can only eat a small amount.
And so what happens to the rest of the stomach that's sitting here? It's just sitting there?
It just sits there. That part sits there because that part still makes certain things that you need for the body to function. But everything that's in that area is going to go down. For example, the bile that the liver is going to make that helps you digest oil, that part is still going to be made by the liver. And instead of going into that part 1 and 2 that I mentioned, it's going to go straight into 3 and 4. So everything is going to meet in that part 3 and 4, and that's where you start absorbing. So with that surgery, is 2 things going to happen. One, you cannot eat as much because we're going to cut it and create a pouch, and we're going to bypass a long segment of where you usually be able to absorb all the fat and all the things, part of the things that you eat. We're going to bypass that, so you can only absorb a small amount. So you can take a small amount and your body can only absorb a small amount. That's why people lose that weight so fast.
So you said 2 important things here. The first thing was that you make the new stomach, if you will, smaller. That stomach pouch is super tiny. So since it's so small, someone should get full a lot quicker, a lot faster with less food. And the second thing you said is that you're no longer passing the food and the fat and all that stuff into this other area. It's going directly into the intestine so that you can then shit it out.
Exactly. So if you imagine it, if you have a long road, instead of taking that entire distance for an hour, you take a shortcut. So that's what we do with the food. Instead of the food going all the way down I-95, and then we make a shortcut, and then you take it halfway.
Okay, guys. So I'm going to do this a little differently than I have during previous Therapy Thursdays. I want you to post your questions in the chat. So as we're going along, this can be a little complicated. So I don't want you to save your questions to the end. I want you to ask these questions right now. You have the expert, Dr. Romaine Joseph. You are the expert tonight, sir.
Thank you.
That's right. You have, how long have you been practicing medicine?
Over 10 years in South Florida.
Gotcha. In total, if you
Oh,
include other
oh,
places,
that's gonna definitely say my age. Besides the grays, over 15 years now.
hey, I mean, I think I may be a little older than you. I've been
Nah.
practicing medicine for 18 years. If you know, I graduated med school in 2003, residency in 2007. So I think I'm older, Dr. Joseph.
It's just a year behind. Just a year behind.
Got it. Okay, so guys, we just showed you gastric bypass. We showed you a video. We showed you a diagram of what happens. And so tell us, Dr. J, what are the three, or I don't want to limit it to three. What are the most popular ways surgically to help folks lose weight?
Excellent question. Surgically, there's the gastric bypass, as you can see, and then that we just discussed. With the gastric bypass, the success rate, and when I talk about success, I mean losing the weight and keep it off for a period of 5 years. The success rate with the gastric bypass is higher. It's about 70-80% because there's no way of reversing this one. The next one is the gastric sleeve. The gastric sleeve, and we'll talk about that, is the same stomach that you saw earlier, but we cut the stomach and leaving behind a small portion. It's like a banana, like a sleeve of a shirt, long sleeve shirt. That's why we call it the gastric sleeve. That's the second, and actually in this day and age, this is the most common surgery that we do for weight loss. That's exactly right. So the first one that you see, the gastric sleeve, so you take the stomach and you cut it. You leave behind a part that's look like a sleeve. We call it the gastric sleeve. The other part, we remove it totally from the body. So it's out. With this surgery, the success rate is still about 60-70%. It's a 70% chance that you will lose the weight and keep it off over the period of 5 years. And the complication rate is very minimal compared to the gastric bypass. Because of all the cutting in the gastric bypass and the reconnection, the complication rate is significantly higher. So with the gastric sleeve, success rate is very high, 60-70%, and the complication is very low. The other one is the lap band. The lap band, a lot of people don't even do that anymore because the failure rate is so high. It's above 60%. You can read it, and some people might say the success rate is high, but that's over 2 years. Over 2 or 3 years, the success rate is high, but you realize that after that, most people will regain the weight because they figure out how to still eat whatever they want to eat. This is why we say all the time, it's more the weight gain. It has a lot to do with the psyche of the person. It's also a mental health issue. So lap band is, as you can see in the middle picture, we take an elastic band, a special band, and we put it around the stomach. That makes it tight. So whenever you eat, you feel full really quickly. That is a restrictive. Because of that, you don't eat. And the tube that you see connected to it, we keep inflating that with fluid, and that makes the stomach tighter, the band tighter and tighter. So because of that, you keep eating less and less and less. And that's how people lose the weight. The one that's not there is the other one that we do is the balloon, the gastric balloon. And we can discuss that a little bit later. It's pretty much very simple. It's a balloon that we put inside the stomach. It takes about 15 minutes to do. There's no surgery per se involved. You put the balloon inside and it makes you feel like you just ate a burger or 2 burgers. So you still feel full over time. And because of that, you tend not to eat much. That's the gastric balloon. So those are the 4 procedures that we do most often.
Thank you very much for explaining that. Sorry, you were giving such a very clear explanation of the different procedures. I just had to mute myself so you didn't have any interruptions. I want to take a question or two. This is the first question. Is there a medical condition a person must have to be eligible to have this procedure?
Another excellent question. No, what we go by is the BMI, the body mass index. What we do, if it's a certain, we take the height of the person and the weight of the person and we put that into a formula. And with that, we decide if you'll come up with a number. Okay, so everybody that's currently following us, if they take their height um, in feet or inches, and then their weight, and then we plug that into a formula, and then we come up with a number. Let's say that number is between 35 and 40. If that number is between 35 and 40, you need to have one medical condition to be qualified, for the insurance companies to qualify and allow you to have that surgery and cover it. That condition can be you have high blood pressure, you have diabetes, sleep apnea, any of those medical conditions, then they will approve it. If the BMI is above 40, then they approve it automatically. So most people will be between those two, 30 to 35 to 40 or 40 plus. So if you're 40 plus, you don't need to have a medical conditions. If you're between 35 and 40, you need to have one medical condition. And I can tell you, most people do.
All right. Thank you for that very specific response. Thank you so much. You're dropping some gems in here. If anyone's watching and you guys are considering going the route of a surgical procedure to help you lose weight, I want to say this to you. Whatever you're doing to lose weight, whether it's been a diet, you've been exercising consistently, you've had a trainer, and you're considering the surgery, don't allow anyone to shame you. Don't allow anyone to add to your burden already, the burden that you carry of the challenges of losing weight. Don't allow people to do that to you. Dr. Joseph, let me ask you this. Through your studies and your research, and I don't recall in medical school from 1999 to 2003 learning that there was an obesity gene. But recently with my reading, I've found that a lot of researchers have mentioned obesity genes.
Definitely. I mean, it's been for as far as I can remember, we've known that it's not just purely a social issue or just a mental issue. So we know that it's familial, it's genetics. Some people just have a difficult way to metabolize whatever they eat. And that causes them to gain weight. And we say all the time that weight gain has to do with calories, not calories you take in versus calorie you lose. Unfortunately, your metabolism has a lot to do with it. So you might, to put it simply, you might eat a burger, and if you in your 20s and you don't gain any weight, you eat the same burger when you're in your 40s or 50s, and then you gain 10 pounds. So that because your metabolism over time changes, and we see that familial in certain families, they have the same issue that causes them to gain that weight and have difficulty losing weight. That's why before you have the surgery, it's important that your doctor make sure that they contact your PCP. Your surgeon will contact your PCP. Make sure you get all the blood work done. We talk about your family. We go all into that history to make sure that it's not that the family is eating the same food. It's not just that, but that your metabolism, the hormones all those things are within normal. Without going into details, they are glands inside the body that control the person's metabolism. So we want to make sure all those glands are functioning normally before we go ahead and do the surgery, so we can address all the issues at once. So
Yeah.
that's why it's so important for people to not just go ahead and have the surgery, but put everything in perspective, not including the mental and the physical issue involving weight gain.
Absolutely. And so here's another question from the audience. What happens
if what happens if someone overeats? That's an excellent question. Um, it is possible. What happens very often, it's as if you overeat now, okay, without surgery. So if you overeat right now without having surgery, you feel full. You might feel so uncomfortable that you vomit. You might feel uncomfortable where you can't move, and those are the same thing that's happened after surgery. If you have the surgery and then you overeat, you're going to feel the same way. The difference is, if before you used to eat 3 burgers before you feel full, now you eat a quarter of one and you feel the same sensation. You feel full. So that is as far as the surgery itself. It's not like the surgery is going to go wrong. Something is going to pop. Nothing like that. It's just that you will feel so full that you might vomit. So it's definitely not recommended. Not after that kind of surgery.
Perfect, perfect, perfect. So let's see. Someone wants to know what's the rate on the balloon. So we showed the 3 different surgeries: the gastric band, the gastric bypass, and shoot, what was the other one, Doc?
The gastric sleeve.
Yes, the sleeve. And you talked about the balloon. The balloon wasn't on the diagram. What's the success rate or the failure rate or both of the balloon?
Excellent question. The balloon is a little different because the success rate of the balloon is limited because after 6 months, normally we remove the balloon. The balloon is to give people that need that jump start. Someone that wants to exercise, but they can't start it, or someone that wants to lose 20, 30 pounds right away. So the failure rate, I wouldn't say failure rate, because we know that the balloon is not permanent. We're going to put the balloon for 6 months. After 6 months, you will remove the balloon. So if by 6 months you did not change your habits, then you will gain the weight again. If you go back to the old habits, you will gain the weight. That's why when we put the balloon, we make sure that we give the patient or the guest, the person, a trainer and a dietitian along with it, because we need to make sure that you're going to change your ways. That will allow the balloon is just to give you that jump start if you don't want surgery. A lot of times we do that for people that are about to have to get married. Before your wedding, a lot of people want to lose 30 pounds. So we put a balloon, you lose 30 pounds, but we do everything possible so you can change the habit. Because remember, weight gain is not, it has a lot to do with habits, the way you live your life. So we want to make sure we change those habits during that time of the balloon, because you can't eat much with the balloon. You feel full anyway. So that's when to start working out, so forth, after taking the balloon. But it's a quick way of losing the weight without surgery. It takes, like I said, it takes 15 minutes and then you go right back to work.
Wow, 15 minutes, that's it?
That's it, 15 minutes. You 50, 30 minutes, we put the give you a little things to make you feel oozy, a little juice. You feel oozy, and we put the camera in, look at the stomach, make sure it's okay, and drop the balloon in.
Gotcha.
Off you go.
Since you just mentioned the 15 minutes, and you go to work or wherever you go after the gastric balloon, someone just asked, what is the recovery process for the gastric bypass? What is that like?
The gastric bypass is a little different because after the surgery, we want to make sure that all the connections, because remember, we're cutting the stomach and then we're bypassing the intestine and reconnecting. So after the surgery, we want to make sure that someone is doing okay and all the connections are properly done. So after the day after, the person is going to get some contrast study, going to swallow something, and then we follow it through to make sure everything goes where they're supposed to go. So the person stays at the hospital for 24 hours. Then the recovery has to do with pain management. We want to make sure the person is up and about as soon as possible. Remember, we do the surgery mostly in people that's significantly overweight, morbidly obese. So we have to assist them in getting up, walking around. So they get up really pretty quickly, but with assistance. So the recovery process is individualized. So depending on the person, depending on what they can do, depending on the exercise and the activities they can do before, those are the ones that we push so they can do after. But what's good is that over the, let's say, 2 weeks to a month, you will lose about 10, 15 pounds. I mean, you lose the weight fairly quickly with the gastric bypass.
All right, I'm sorry. I was also responding to, we have some excellent questions in the chat. So I'm responding to some things. I got a little delayed. Thank you so much. So people are asking, what is the cost approximately of the balloon? And is it cost effective is the other question.
Exactly. I mean, that's the thing. We want to make sure that if you do the procedure, we don't just put the balloon for you and let you go. Because the goal is to make sure that even if we know we're going to remove the balloon in about 6 months, that you're going to be able to keep that weight off. The goal is to give you that jump start to change your life. The cost of the balloon is about 1/3 of the gastric bypass and gastric sleeves. So that's, if you include everything, hospital included, it's about $15,000 plus and minus for the gastric sleeve or the gastric bypass. So the cost of the balloon is about 1/3 of that, $5,000-6,000 about.
All right. Okay. So I think you made that balloon sound sexy. If you notice, tempting for a lot of people, you know.
It works. It's for most people that have medical conditions and they feel concerned about going under anesthesia. The balloon usually works.
Okay. So we have a question, I guess, about plateauing. Someone's weight plateauing. She says, is it common for the weight loss to stall on these at some point? Will people stop losing weight with the gastric bypass, with the gastric lap band, with the gastric sleeve? How does that work?
This is another excellent question today. That's very nice. Definitely. So everyone has their weight, per se, that they will achieve. So after surgery, you will plateau. You will reach that weight where you feel like you're not losing anymore. That's what they call the plateau. It is about in approximately 2 years after surgery. So 2 years after the surgery, most people will reach that plateau where you lost all the weight that normally you would lose. This is the reason that during that time, we have to introduce the someone that's going to guide you with your fitness. Because during that time, this is the perfect opportunity while you're losing the weight to start changing your lifestyle and start including exercising. So after you plateau, once you start exercising, you will continue to lose that weight. So most people, you have to watch them after 2 years so they don't go back to eating. They don't go back to eating the way they used to. But in addition to that, they start including exercising into their lifestyle. So that's very important. So to answer the question, most people will, after approximately 2 years, you will start plateauing. The way to keep it going is by including exercise into your daily practice, daily routine or weekly routine. You don't even need to do it daily.
Well, we ain't gonna tell them that, Doc. They got
No, I don't do it daily. There's no way I can do it daily, but
right,
but doing several times a week, definitely it's more feasible, more for everybody.
right. So here's a question: what percentage have you personally seen success rates or success results? So, okay, I guess the success
Uh,
rate after the balloon
mhm.
has been removed compared to the other processes. How long are they keeping the weight off? I suppose.
That's another excellent question. What we know is that with the gastric sleeve, the gastric bypass, the success rate is significantly higher. With the balloon, after we remove the balloon after 6 months, in our case, in our patients, what we do is make sure that they follow up with dietitian and they follow up with the personal trainer. That's why we tell our patients, when you will see us, we're going to get married. We're going to be together for the longest, because your success is our success. Our success depends on your success. Because of that, we make sure that even after we remove the balloon, we'll continue to make sure that you follow up with the personal trainer. That's why we push it so much before we remove the balloon, because we want it to be for you to develop a different habit, to change your daily activity, your daily routine. So within that 6 months, you start exercising and it becomes routine that every other day that you do certain activities to keep it off. Once we remove the balloon, you continue with the diet and the exercise. So far we've had achieved the same 70%, 80% success rate, and we hope that will continue. So we tell people, listen, we're going to sign the contract, we're going to get married for life, because we want to make sure that my success depends on your success and your success depends on ours.
That's awesome. 70% is that's a good success rate. So let's see. Outside of having surgery, does your stomach naturally shrink when you decrease your food intake over an extended period of time?
Yes.
That is a yes. That is a big yes, my dear.
That is definitely true. That is definitely true. The way you realize that is, if you, for example, used to eat, let's say, 4 burgers. If you used to eat 4 burgers and then you decide you're going to cut that to two, the day that you eat 3 burgers, you feel full, as if that's the first time you have eaten 3 burgers. So your stomach, definitely, the skin is elastic. Your stomach is made of muscle. And of course, if you don't use it, if you don't stretch it, over time, it will shrink. You will feel full a lot sooner, but that's difficult for most people because every now and then, every uh, opportunity, every special occasion, Thanksgiving or something like that, you stretch it again. Or every 2 weeks or every month you go out, go to a restaurant, you overeat. That happens a lot. So if you don't, yes, the stomach will shrink, but not so much that you can't stretch it again, but it will definitely shrink again. The same way, if it's small, you can expand it. So someone that has a gastric sleeve with a small stomach, if they keep overeating, they will keep extending that stomach. Same for the gastric bypass, that little pouch that you see, people can still make it bigger and bigger and bigger over time. It might not reach the same size that it was initially, but it will definitely get bigger.
Okay. So for folks who may be new to the conversation, I'm speaking with Dr. Romain Joseph. He is a surgeon and he has performed all sorts of different surgeries, including robotic surgeries. And he is the man at the gastric bypass procedures, as well as the gastric sleeve, the gastric lap band, and the balloon, which we've been talking about all four of these procedures. And I just want folks to know, I mentioned in the very beginning what hospitals where you're on staff. And so I'll mention it again because I want folks to, if you're going to consider this type of intervention, you should do this with someone you can trust who's going to talk to you and ensure that you check the box in all the areas to maintain the weight and keep the weight off. And so Dr. Joseph has mentioned several times mental health and wellness. So, you got to have brain love when it comes to your health and nutrition, your brain, and, everything that's brain, which includes your weight. And so, Dr. Joseph, tell us, what hospitals are you affiliated with, please?
Three main hospitals. That's Jackson North Medical Center, North Shore Medical Center, and Florida Medical Center, and multiple surgical centers around South Florida. What I tell my patients all the time, it's no matter where you go, let's say you decide not to choose us, no matter where you go, is the surgeon that's important. The hospital is part of it, but if you have a surgeon that makes it personal, that for whom you're not a number, that's where the success rate comes in. And I tell my patients all the time that I don't work for hospitals. I work for my patients. So no matter where you go, no matter where we are, we will be the one to take care of you, and we make it personal. Like I said, your success depends on mine, and failure is not an option.
All right. We appreciate that. I'm disappointed at times when someone comes to me for mental health clearance for a gastric bypass or gastric sleeve or gastric lap band, and they can't tell me anything about the procedure. Because I have to determine that they have the capacity to make the decision. And to determine that someone has the capacity, they must demonstrate to you, in the most basic terms, because I know that most folks are not medical professionals, but you have to be able to explain in the most basic terms what the risk and benefits are of this surgery.
Definitely.
And you have to be able to explain what you've been doing to achieve weight loss during this time, during this interim of time that you've been challenged by your weight management. And so, I just want people to understand, when you do go see a surgeon about this, be sure to ask all of those questions. Dr. Joseph, I'm sure you meet with folks, you do the consultation, and you explain everything to them, and you're available to answer questions.
Definitely, and you hit the nail right on the head. This is one of the most important thing, and I say that to my patients all the time, or to everyone in general. Surgery is not a walk in the park. It is a very serious process. Um, it's someone's life that's going to be in your hand, and someone's life your life that you're going to put in someone's hand. So it is important that you ask all the questions possible. If you want, if you can always do the research, make a list of questions, and so you can ask, or you see someone as a second opinion, which we welcome our patients to do all the time. Go and get a second opinion. Come to us and get a second opinion so you can know what questions to ask. And don't hesitate, because your life is what you're going to put in someone's hand. Don't feel shy. Don't certainly do not feel shy. Ask all the questions that you can think of. And we usually welcome people to bring their family. With the COVID, it might be a little difficult, but we ask them to have their family contact us to ask us questions, because you even if you are the one going into surgery, whatever happened to you, or whatever, good, bad, no matter what it is, your family will be involved. So it is good to have your family present so they can ask questions. They can remember questions that you don't remember, because you're nervous, you're unsure of what to ask, but your family will be able to help you ask the right questions. So don't hesitate, ask as many questions as you can.
Really quickly, give us some of the risk involved, some of the risk, and also tell us what are some of the common reactions that folks have after they have undergone one of these procedures. Maybe start with the gastric bypass.
With the gastric bypass, one of the most common one is the fact that the patients tend not to eat or have their vitamins the way they're supposed to. Once you have this kind of surgery, your vitamins is going to be your best friend. You have to have vitamins for the rest of your life because there's certain part of the stomach that you remove, and with the bypass, there's certain part of the intestine that you will bypass, but you still need those vitamins. So we let all of our patients know that your vitamins should be exactly the same place as you put your toothpaste, your toothbrush. So when you wake up, you know that you're going to take your vitamins. Have it in your car, have it at work, in your purse, all over. So if you forget to take it in the morning, you'll remember to take it sometimes during the day. The risk of surgery is bleeding. With every surgery, so you always have a risk of bleeding. We stop the bleeding during surgery. The infection is always a risk of surgery. That's why we clean the body. That's why we actually send our patient before surgery with some soap, so you can special soap so you can use the day before surgery, and we give you antibiotics before the surgery. And there's always a risk of leak because whenever you're connecting, reconnecting, there's always a risk that one of the connection might not be 100%. That's why we test it over and over and over during surgery. We don't wait to do it after, but we do that during surgery. That's why when we do the surgery ourselves, there are two surgeons that operate together, myself and my partner, because we always feel that this surgery is so important that two set of eyes is definitely better than just one. So we know that people do it by themselves. You can, but having two surgeons that's doing the surgery for you, we always feel this is safest. So, and a risk of death, it's always there with every surgery. Post surgery, there's a risk of having blood clots. This is why we make it something very important that after surgery, our patients start walking the next day, and we put them on blood thinners to make sure they don't develop blood clots. So it's important after surgery that you start walking around. This is pretty much after every surgeries. We want you to be up and walking and about. Those are the main complications after surgery.
Thank you very much for that. So we're wrapping it up, Dr. Joseph. I really appreciate your time on the show tonight. I do want to get this question up. What effects does weight loss surgery have on blood pressure, which we know is a very common issue in the Black community?
This is I see this every day, and this is the great satisfaction that we have after we do the surgeries, is that our patient comes and says, "Doc, I don't need my blood pressure medication anymore." This is like 2 weeks after surgery. 2 weeks after surgery, for someone to say, "Have been on blood pressure medication for 10 years, and then now I don't need it. My doctor says I can do without it. Or I've been on diabetic medication for 10 years, and then now I don't need it anymore." And then, so the effect of weight loss surgeries is that after 2 weeks, a month, you will not need those blood pressure medications. You will not, and imagine the blood pressure will work on your heart, on your brain. That can cause your heart problem, cause your kidney problem later on. That's why we recommend the surgery. It works. It reduces your blood pressure. It add many and many years to your life.
Okay, so we're going to wrap it up with just a little bit of a game of myth versus fact, if you don't mind, Dr. Joseph. Is that okay? It'll only take a couple of minutes.
I'm all yours.
Okay, let's pull up that myth versus fact. Well, the introductory side first. Yes, there it is. Myth versus fact, guys. So if you're not already following me here on Facebook or on YouTube, please subscribe to my YouTube channel, which is Dr. Delvina Thomas. You'll see it at the end. And on Facebook, If you're watching this on Facebook, you know I'm Dr. Delvina. So please like my page so you can see my post and you can follow along with future Therapy Thursdays. So the first question we have for myth versus fact. Is everyone ready? An average adult has about 50 billion fat cells, which means there are more fat cells in one person than there are people on Earth. Guys, do we have 50 billion fat cells? What says you, Dr. Joseph?
That's a big number. That's a big number.
You're right. It's a fact.
It's a fact. It's a lot.
It's a fact. That is a fact. We have 50 billion fat cells in our bodies. And I just want to make a point. I think that's why it's so difficult. You know, people do you do liposuction, Dr. Joseph?
No. I've been asked this all the time. But my patients all ask me that all the time. But we have in the Joseph Surgery group, we have a plastic surgeons on board that will do all that will do the liposuction. So we have a plastic surgeon in the group. It does the liposuction, the tummy tuck, the breast reconstruction, and so forth.
Oh, wow. So you guys are making models up in
It's
there.
a full package.
Well, I'll say this. I've seen people who've had liposuction and it comes right on back. And that has a lot to do with those fat cells because listen,
Definitely.
you can never get rid of the fat cells. You never get rid of your fat cells. They shrink. They don't disappear. When you eat healthy, when you lose weight, when you're exercising consistently, what happens is that they shrink, but they don't disappear. So that's why it's so easy to regain your weight.
Yes.
So you have to, this has to be a lifestyle. Okay.
Definitely. It's a mental health issue.
Yes, sir. So next, myth versus fact. Healthy nutrition and exercise do not make fat cells disappear. Dang it, I just
you just give that one away.
Instead, fat cells become like deflated balloons waiting to be refilled again. Guys, is that a myth or is it a fact? Myth or fact, guys? What says the world? That is
That's a fact.
Yes, it's a fact. And so we have one more. Some people have twice as many fat cells as other people. Additionally, the cells of overweight and obese people hold more fat. Is that a myth or a fact? Do obese, overweight people, do their fat cells hold more fat, guys? What do you think? I hope you're saying inside of your head that's a fact. Because it is a fact, folks. That is a fact. So, Dr. Joseph, I am so grateful for you joining me tonight. I have so much gratitude. I know you're a surgeon. I know you are extremely busy. You have a family. You need your me time. You need your time to decompress. And you gave me an hour of your time tonight. Folks, if you're considering this type of intervention to help you with weight management, please call Dr. Joseph. Dr. Joseph, give them your phone number, please.
My phone number is 786-401-6455. 786-401-6455. And that's the same number for both offices, both the one in Broward, which is on 4900 West Oakland Park Boulevard, Suite 202, and the one in Miami Shores, which is on 9415 Northeast 6th Avenue in Miami Shores.
And I'll come back, guys, once we're out of this broadcast, and I'll post the address for his practices. I posted the phone number here. It's on the YouTube in the comment section. It's also on the Facebook page in the comment section. So share this information with those you love, man, because when you lose weight and stuff and you're healthier, you live longer and you're happier. Some people are very unhappy being overweight and obese.
And we need people to be healthier in our community.
Yes.
Definitely.
Yeah. We have a lot more obese people and overweight folks in the Black community also. So, all righty. Guys, thanks for joining me tonight. Dr. Joseph, Thank you very much.
My pleasure, always.
I hope you don't mind my sharing this on my podcast, The Brain Love Podcast. Yes, I'm always pitching.
Please do, please do. It's always a pleasure.
Yes, everyone, please subscribe to The Brain Love Podcast. Give me a rating, comment, share it with your loved one. It's some good stuff. I think it's some good stuff. And I'm coming up on a 1-year anniversary of my podcast. My 1-year anniversary is coming up. All right. Any last words, Dr. Joseph?
Thank you so very much for this invitation. It was a great honor to be here and sharing the information with the entire community. I wish that everybody will remember what we talk about. Your health is very important to us. We will do everything possible to make sure everything goes on point and that you lose the weight as needed and that you keep it off. The most important thing is that you stay healthy. A healthy individual, a healthy community is best for all of us. So we wish you all the best and thank you again for the invitation.
You are very welcome. You got that last word. Thank you.
Thank you.
All right, folks, everybody have a great night.